los terroristas.
And do the Harlem Shake.
Adderall is a central nervous system stimulant prescription medicine. It is used for the treatment of attention-deficient hyperactivity disorder known as ADHD. It is a controlled substance known as a Class 2 because it can be abused or led to dependence. Some important information about Adderall is it has been linked to heart-related problems, such as sudden death in patients who have had heart problems or heart defects, stroke and heart attacks in adults, increased blood pressure and heart rate. Some other problems are mental problems. In all patients, new or worse behavior and thought problems, new or worse bipolar illnesses, new or worse aggressive behavioral hostility. Sometimes children and teenagers develop psychotic symptoms such as hearing voices, believing things that are not true and are suspicious, or new manic symptoms. Adderall may not be right for you if you have heart problems, heart defects, high blood pressure, mental problems including psychosis, mania, bipolar illness or depression, tics or Tourette syndrome, liver or kidney problems, thyroid problems, seizures, or have had a normal brain wave test called EEG. Adderall can interact with other medication and cause serious side effects. Some medication it can interact with is antidepressant medicine, blood pressure medicine, seizure medicine, blood thinner medicine, cold or allergy medicine, and stomach acid medicine.
Mercer University, that's the Southern School of Pharmacy, located here in Atlanta, Georgia. Yes, Adderall is a drug that's indicated for ADHD, which is Attention Deficit Hyperactivity Disorder. It is a CNN stimulant. Basically, it stimulates the whole body, the whole brain. So most of the times, Adderall is indicated for ADHD, but some doctors use it off-label. Adderall is a C2 drug. A C2 drug means for a drug to be categorized under C2, first, it has the potential to be abused. 2 is addictive, that's given. Well, if for a healthy child, a child that doesn't have any health problems like heart problems or mental disorders, if they use it for a short period of time, it's good. But as we have seen for many years, once they start, they never stop. Instead of stopping, their dose increases every 6 months or a year. They start from 10 milligrams and they end up taking 100 milligrams. Years ago, we used to see adolescents, from like 10, 11, 12. But these days, the kids, they start from 4, they go all the way to the college. Even though the dose increased from taking 1 tablet a day, they make it to 4. And those people who get this prescription, they misuse it. Basically, they sell it on the street or give it to their friends. But one thing that any patient who takes Adderall, unless you have your prescription with you, is a felony. So you go to jail if the police catch you with even 1 tablet. Yeah, so the first is your health. If your health is not checked, if you have nobody knows that you have heart problem unless you get checked. You may have, any mental disorders. So when you add Adderall on the top of that, you're going to make it worse. And the other is having the prescription, the tablet without prescription, legal prescription. The main side effect when a patient takes, or overdose themselves is their behavior changes. Their personality totally changes. And the other one is, we have seen a lot of kids who take Adderall, now they take sleep medication. Yeah, starting, I'm talking 5-6 years, then those sleep medication have another side effect. To cover that side effect, you end up another prescription. So at the end of the day, yeah. The problem we have seen is, doctor used to be very picky before. They don't give Adderall for everybody. Now, once you get checked, they give you more and more. And like even the number of prescription, like in a busy pharmacy, you see 4 or 5 kids. But these days, in one day, seeing 40, 50 people is common.
This was Richard Fee, a 24-year-old college graduate. He was an athlete, college class president, and a medical student. Richard decided to change his life plans by Adderall. Richard, one among many, went to the doctor and faked symptoms of ADHD to receive a prescription. His friends said he wanted it only for studying. However, Adderall decided to take over Richard's mind. Richard got addicted to Adderall. His parents started to worry because of his weird behavior. His mom said, "One time I saw him duct tape his computer camera because he thought people were spying on him, or his fingertips because he didn't want to leave fingerprints. He would go out to talk to the moon and stars and even reply to the television." Because Richard was abusing his Adderall, he ran out of his medication too soon before he can go ahead and get his next refill. This made him go through bad withdrawals. I quote his parents, "We used to lock our door at night because we were scared of our own son." One time, his parents even received a call from Richard saying that he had a knife and he was going to stab himself in the head. This is where he was put in a mental hospital. Once Richard got out, he went back to it again. It all lasted until November 2012, when the parents of Richard received a missed call. Then they went to check in on Richard in his apartment. His parents found him in the closet, dead. Richard Fee committed suicide. Richard Fee, rest in peace.